Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and today I am going to talk to you about a question that doesn't normally come up in an orthodontic office unless you're really looking for it. And the question that I'm going to be talking about today, does your child snore? And snoring in children, just to be really candid with you straight up front, it's an abnormal response in children. And so if your child snores, that is something that you actually want to be have a little bit of concern about. And so the question becomes, why do children snore? And one of the most common reasons why a child snores is because they have an improper airway, or their airway is obstructed. And so one of the things that we look for in children is this question, does your child snore? Because if they do, then we want to be a little bit more proactive in our approach in their treatment. And so really when we start looking at when this question arises, it could be as early as like maybe a 3-year-old, a 4-year-old, a 5-year-old, a 6-year-old. And so one of the things that we want to do is we want to start really making an assessment of this condition. And so typically the first step that we typically do is we really want to have your tonsils and adenoids checked. And so one of the things that can obstruct airway is an enlarged tonsils, enlarged adenoids. And so this is something that we would refer you to, or your family doctor will refer you to an ear, nose, and throat specialist, and we'll make that evaluation on whether you have enlarged tonsils or adenoids. The second thing that what we look at is really looking at your child's dentition, which means your mouth. And what we're looking for is does your child have enough space for all the adult teeth? Is the jaw wide enough to support to have a proper airway? And so when we're looking at treatment in children, what we're looking at is really doing a segment of treatment where we have the tonsils and adenoids looked at. They could possibly be removed. If we still have snoring, then we really want to then initiate the orthodontic treatment to widen the arches to make it as wide as possible. And so that's typically our standard of treatment for children that have a snoring issue. And one of the things that you could do is, and sometimes this is recommended either prior to the tonsil adenoids removal or prior to the orthodontic treatment, sometimes we'll actually have a child do a sleep study, or we'll actually do the sleep study after the orthodontic treatment and after the tonsils are taken out. That way we know we're rest assured that the snoring's gone away. And the reason this is really important, and I think it's one of the big issues why it's a hot button to us, and is because a lot of children get diagnosed with attention deficit disorder. And they get, they're restless, they're overexcited. And the reason this is important is sometimes it's actually attention deficit disorder is misdiagnosed for an improper airway problem. And so one of the things that we start to see is there's a lot of children who, when they have improper sleep at night, they're irritable and agitated, and they're not getting the proper type of sleep. And so that gets misdiagnosed as attention deficit disorder, but in reality, it's really your child's just not getting adequate sleep and good sleep. And so one of the things that I want you to do is really consider this, ask yourself does your children snore? And just understand that this is not a normal response in children. And so if you have any questions related to this topic, please give us a call in the office. And we look forward to answering any questions because, like I said, this is a really hot button issue, and it's something that we in our office gear our treatment around, is because we really are concerned about airway and having the proper airway as children are developing from their, whether they're 4, 5, 6, all the way up into their teens. So this has been the Friday Focus. If you have any questions, look forward to seeing you next time. Call the office and we can answer any questions you have about this topic. Thank you.